This is LiveWell Talk on new Clinician Spotlight. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health, St. Luke's Hospital. Today is another installment in the podcast where we sit down with new clinicians at UnityPoint Health, Cedar Rapids, and get to know them and find out a little bit about them and their interests, both clinically and personally. And our guest today is Andrea Childs, a nurse practitioner at UnityPoint Clinic Pediatrics, Terrace. Andrea, welcome to the podcast.
Thank you for having me.
Now, you work with Dr. Conte out there, you said. She's
Yes.
a veteran of the podcast world. We always enjoy having Dr. Conte on. But just let's start. Tell me a little bit about yourself, where you're from, and what family you have.
Yeah, I'm from Ottumwa, Iowa. I grew up there. I have two siblings. And then I went to school at the University of Iowa. I got my undergraduate there for my RN and my BSN. And worked at the University of Iowa for a little bit, and then I decided to go back to school and get my nurse practitioner.
And you have always been doing pediatrics?
Yep. My first year I did cardiology adults just because as a nurse, because I really wanted to
At the university?
That one I did at Mercy, and I wanted to just get some knowledge before I went into peds. But then after that, I've all done pediatrics. Yep.
And you are married? You
Yes.
said that earlier?
Yep.
Children?
I do not have kids. I have two dogs, though.
Two dogs?
Yep.
What kind of dogs?
I have Labradors. They're a lot of energy.
Yeah, they are.
But they're really fun.
Yes, they are.
Yeah.
The podcast is dog friendly.
Yeah. Yeah.
Well, okay. You undergrad at Iowa, medical education at Iowa.
Yep.
And then went into pediatrics. But why'd you say the peds was where you wanted to be?
I've always loved pediatrics, and I've always known I wanted to do peds. I have always loved taking care of and helping children and their families. I've always loved that, and it just was reinforced through nursing. And then I started working as a nurse in pediatrics. A lot of people that know me would say I'm high energy, bubbly, and kids are like that too. So I feel like my energy matches theirs very well. And yeah, I've always just really enjoyed kids. Yeah.
Well, enjoy your job. You'll never work a day in your life. So do you have any particular interest with pediatrics?
So I spent some time in we got to do specialty rotation in school, and I spent some time in pediatric dermatology. So I love skin stuff.
Oh, wow.
I love acne. I love eczema. Any skin stuff I really like, just because I got a lot of clinical stuff rotations in that, and so I learned a lot. But yeah, that's kind of my niche that I like, but I like all pediatrics.
That's one medical condition that I think people are theorizing that artificial intelligence, AI, will take a big role in imaging x-rays.
Mm-hmm.
I think that might happen, but I think AI with skin conditions
Mm-hmm.
will really be a big deal, because I think you'll be able to, identify skin conditions quicker, and be able to start the treatment right away. Because as you know, it takes a long time to get into dermatology,
Yes.
even here in town.
Yes, it does.
Yeah.
And that was one thing too, I thought, when thinking about what specialty rotation I wanted to follow. I'm I feel like skin is something, everybody can have a skin condition. And so I thought it was a really good rotation to do. And I learned so much from it.
Largest organ in the human body.
So true.
Right. You said you worked at that other hospital at one time. So why'd you choose UnityPoint Health?
Yeah. So I did my peds rotation, clinical rotations with UnityPoint at the downtown Cedar Rapids office. And I could not say enough good things, honestly, about all the providers within UnityPoint, but it was such a team network. Just so helpful. Anytime I needed anything, all the providers bouncing ideas off. I loved that environment, and I knew I was when I graduate, I really want to work with UnityPoint. And a job opportunity opened up, and so I took it. So yeah, I cannot say enough good things about just the team here. The providers are just so helpful. I never feel alone. So
well, that's great.
Yeah.
Medicine's a team sport.
Yes.
I mean, we're all on the same team. You landed out at the new clinic,
Yes.
the crown jewel right now. I've not been inside it.
Yeah.
I've been by it, of course, but no, I haven't been inside it. So I need it. Dr. Conte's invited me out there a couple times.
Yes, you can come anytime. I'll invite you as well.
All right. Well, that's two invitations. So, You said you have a lot of energy.
Yeah.
And so how do you relate to the kids? Just with that energy? I mean...
Yeah, sometimes. I think one of the biggest things I've learned through my peds career is that I like to talk through things. Like kids, a lot of their fear and anxiety is like the unknown, right? And so I always say tiny humans are not adults. And so like breaking things down, even if it's something like a simple swab, I love to talk the kid through it. Like, here, let me show you another one of my Q-tips. Let me have you touch this, and like really talking it through, I think can really help. I've developed a lot of like things that I've learned just through my pediatric experience that has really helped me. Yeah.
I was not a lot of, no, I don't want to say that, not a lot of pediatrics, but a significant event in pediatrics is immunizations.
Yeah.
How have you found, we're doing this Ask Me campaign through public health.
Mm-hmm.
I did the shot in the arm,
Mm-hmm.
did physician discussion panel after watching the film about that.
Mm-hmm.
We're trying to, the COVID vaccine,
Mm-hmm.
we overpromised, underdelivered on it, right?
Sure.
And so people have lost trust in vaccination. How's it going? I mean, what do you find on the front lines with immunizations?
Yeah, I feel like, so that's one of the things I love too with care is just like education. I think I always want patients, families, children to make informed decisions, and I want to provide all the resources. And so that's something I really enjoy is like diving into that information, like where are we finding the evidence, looking at what's the best practices on things, and then giving that information on to my patients in ways that they can understand so then they can make the best decision for their child or their family. And so I think that's like the most important tool is education. And I love providing education. I love when patients ask me questions and, they're like, I don't understand this, or I want more information on this. And so, I think that's a big piece to that.
Yeah. I mean, I think immunizations and the ability to vaccinate against infectious disease that can be devastating to mankind is probably our biggest medical achievement, I think. And then maybe the whole mapping of the genome probably in there somewhere. Someone listeners probably saying that right now. But a couple fun questions.
Yeah.
What do you do in your free time?
I enjoy hanging out with my family. I'm really close with my siblings and my parents, and I love hanging out with my husband. How
long you been married?
We've been married for 5 years.
Okay. Well,
yeah.
That'll change.
Yeah. I'm really outdoorsy, so I love to like hike. I like to travel. I love hanging out with my dogs. So, yeah.
Sibling-wise, are you middle child?
I'm the baby. I'm the youngest.
Okay. That explains some things.
My siblings would say that too.
Would they?
Yes.
Were your parents' favorite?
Yes. They would for sure say that.
Well, Andrea, thanks for joining me. This is really informative. I always enjoy these episodes. We're glad that you're here at UnityPoint Health. Once again, this is Andrea Childs, a nurse practitioner at UnityPoint Clinic Pediatrics, Tower Terrace. If you're interested in scheduling an appointment with Andrea, call UnityPoint Clinic Pediatrics, Tower Terrace at 319-206-7370. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe, and if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.